Pat, should we get started?
Sure.
Okay, would you like to do the roll call for us?
Yes, I have on the line Jen Veraday, Shannon Thomas, Mary Garrett Eichen, Lex Fisher, Michelle Bach, Chris Minnick, Dee Welker, Colleen Igo, Stacy.
Paulette Testani. Joined.
Paulette Chestani.
Hello.
Right. Stacy Storkowski, Tracy Johnson, Crystal Karenchek. Is there anyone else on the call that I haven't called your name?
Yes, we're from True North Wellness Services. I'm Dr. Hans Philippin, and with Mike Banks-Devenish.
Great. Nice to have you on the call. How'd you hear about us?
A flyer. I think a flyer came through our offices, and it was circulated. And, yeah.
Wonderful. What county are you in?
We're in Dauphin County, Pennsylvania.
Wonderful. Thank you.
You're welcome.
Okay, I think that's it.
Great. Well, thank you, Pat. Good afternoon, everyone. My name is Chelsea Leonard, and I serve as the Cultural and Linguistic Competence Coordinator for the Pennsylvania System of Care Partnership. We want to welcome you to the kickoff of our CLC webinar series for 2015 this April. This is our first session in a series of 3 on addressing diversity and health disparities in system of care, what we term as the CLC journey. And we have 2 fantastic representatives from our system of care here in Pennsylvania who will be presenting today on their CLC journey, Valerie K. Olds and Jason Landau Goodman. And we're just so thrilled to have them participating and to be able to share a bit of their knowledge in working on CLC and meeting our Pennsylvania standard for CLC. And so we'll progress to our next slide as I give you some additional information and housekeeping information. As I said, this is our CLC series for this year. This being the first session, we will also have another session on April 14th on working with linguistically diverse populations. As I'm sure you're aware, when we talk about cultural and linguistic competence, we often forget the linguistic portion of that standard, and so we really wanted to emphasize that area by providing you with more information, building knowledge, capacity, and hopefully pointing you in the direction of resources that are currently available for improving that area of your work on CLC. Our next session will be on April 21st, and that is Growing Through Partnership and Collaboration, the Pennsylvania System of Care Partnership CLC Pilot Project. This year, we've been very fortunate to carry out a pilot project with 3 counties through the Pennsylvania System of Care Partnership to improve their CLC programming. So those counties are going to participate on a call on this webinar on April 21st, discussing their progress thus far in the pilot project, where we work on conducting an assessment, creating a CLC plan that is a match for your county, and then taking an item from that plan and working through the implementation phase. And so they'll be able to share a bit of their CLC journey during our final webinar in the series. So we really hope you'll be able to attend those. The registration information and meeting information is the same as today's through GoToMeeting and the conference call. So as I said, we really hope you'll be able to join. We are also encouraging you to tweet and share your thoughts via our website and Instagram and our Pinterest if you so choose. But for tweeting on this topic throughout the month of April, feel free to hashtag CLC in your thoughts, and then you can reach us at the Pennsylvania System of Care Twitter account. So if you have questions from today that maybe you can't think of immediately in the webinar session, or you have a great resource you want to make us aware of, feel free to tweet us, and we'd love to hear your thoughts and comments and ideas. And so that leads us into some of our housekeeping for today. And we have two presenters who will be, as I said, sharing their CLC journey. We will be taking questions at the conclusion of each of their presentations. So please feel free to chat your question. So in the GoToMeeting boxes, there is availability for you to use the chat box, the chat feature, to write in your question. Feel free to do that at any time during the presentation, and at the conclusion, I will take those questions and field them to the presenters so they can give their response. So as I said, at the end of each presentation, you'll be able to ask questions. We'll also allow a few minutes at the end of today's session for you to ask any remaining questions you might have. This session is being recorded, so if you need to, please have your phones on mute when you're not speaking, and I think that should be all of our housekeeping. So we'll move on to our next slide. So I'm thrilled, as I said, to introduce Valerie Olds. She holds a JD, Juris Doctorate, and is a program manager for cross-system initiatives in the Philadelphia Department of Behavioral Health and Intellectual Disability Services. Her area of focus at DBHIDS has been children, youth, and families, with a focus on cross-system initiatives. She is currently the county lead for High Fidelity Wraparound and System of Care in Philadelphia. Ms. Olds is a member of the PA State Leadership and Management Team and the Youth and Family Training Institute's Advisory Board. In her role at DBHIDS, she's also the coordinator of the DBHIDS Family Member Committee that meets monthly and is involved in system-wide efforts to increase family member involvement and engagement. And so we're so thrilled to have Valerie, and I'll allow her to take over and talk to you a bit about these wonderful pictures she has up for you on her presentation.
Thank you very much for that introduction, Kelsey, and good afternoon to everyone. I'm really thrilled to be able to participate in this webinar series. And a word about the pictures, so I was asked to provide a picture for the webinar, and I don't have, quote unquote, a professional photo. So I thought, let me just put up two that I happen to like personally. The first one is with my son, Ellis, who had just graduated from a program, a college program, last year. And the other is my daughter at Temple University, where she now attends, the Philadelphia University, and it's also my alma mater. So I thought, since we're talking about Philadelphia, there's a little taste of Philly there. So I'm going to spend today focusing on Philadelphia, our system of care, but also in the broader sense, what my department, the Department of Behavioral Health and Intellectual Disability Services, has done around promoting cultural competence as well as linguistic competence. So just for a quick overview, I'll first talk about Philadelphia's profile in terms of our demographics as a city. And then I will talk about some pieces around cultural competence that we have both internally and in our communities regarding behavioral health. And then I'll end with talking about how we're addressing some of the disparities that we have identified here in Philadelphia. So I found this comic to illustrate the fact that depending upon where you're from, what you are looking at through your particular lens really influences what you see. So as you can see, someone from a very cold weather area is thinking it's about snowballs, and the other person thinks it's coconuts. And really both could be correct. And so this just, to me, I thought was a funny way to highlight why it's important to understand the cultural context when we are working with people. Now, Philadelphia, some years back in 2008, had a person-first task force that was charged with looking at cultural competence and really coming up with a framework and a definition around how we would incorporate that as one of our core principles. And so this definition is what the task force, which is made up of both internal and external community stakeholders, arrived at. A person-first orientation is a key element of recovery and resilience-oriented services. It means that a person's race, ethnicity, language capability, religion, spirituality, gender identity, sexual orientation, social role, age, physical ability, cognitive ability, and or economic status is acknowledged and incorporated in the delivery of services. So from this definition, as you can see, it's a very, very broad lens of what constitutes culture and what constitutes what one needs to take into account when working with people from a behavioral health standpoint, in terms of clinical standards, skills, service approaches, etc. The last line says a person-first approach to the delivery of service also means that all people are entitled to strengths-based, holistic services that are relevant to and appropriate for them. So again, building on the idea that services really need to be not cookie-cutter, but really individualized, and a person's culture is a very, very key component of that. So I thought I'd talk a little bit about Philadelphia and our diverse community. We have a little over 1.5 million people. We're the 6th largest city in the United States. And our racial and ethnic population, as you can see, is diverse. 42% are African American, 37% are white, 13% Hispanic, 6% Asian, and there is about 2% that identifies other. In terms of languages, 21% of Philadelphians say that they speak a language other than English. LGBT community, there are approximately 26,000 individuals who identify as lesbian, gay, bisexual, or transgender. Significant part of our community here. And then some more sobering kinds of statistics. So, as a city, with a high rate of violence and have, unfortunately, the distinction of having the highest homicide rate among the 10 largest cities. We also have a very, very high rate of poverty. We, unfortunately, have the distinction of being the poorest big city in America, with a rate of deep poverty of around 26%. Now, this slide shows a map in terms of the diversity. We are known as a city of neighborhoods, and in about half of the city's residential zip codes, African American and Caucasians account for 75% of the population. In 8 of our zip codes, there's no majority group. And in one particular zip code, there is a representation of 10% of African Americans, Caucasians, Hispanics, and Asians. So very, very diverse in that one community. In terms of setting out a framework for, how is it that we look at organizing around cultural and linguistic competence. So I borrowed from the Georgetown University Center for Child and Human Development, National Center for Cultural Competence, and they talk in terms of guiding values and principles. So we have the organizational values and principles where, how do organizations or agencies incorporate cultural knowledge into their infrastructure, their practice, making policies? And how do they ensure that there's equal access and non-discrimination in terms of services that they either deliver or pay for? And in our case, we pay for services. And when I say we, I will be referring both to the Department of Behavioral Health as well as Community Behavioral Health, which is our managed care organization. and then the other lens is around, practice and design of services. So what does our provider network look like in terms of being able to meet the needs of the diverse communities that we have here? And, assuring that the organizations tailor the services that they provide to the needs of that particular community. And last and certainly not least, the idea of family culturally is defined differently depending on which culture you are involved with. And so understanding that particular family's culture is also a very, very key part of working with families. So with that said, I'm going to start out by talking about some of the internal structures that we have within DBH and CBH. CBH has a member services division, which is 24/7 for members to call in to get resources, information. They have 36 employees who speak 13 different languages. And CBH also maintains a translation service for any of its providers to use. DBH also issued practice guidelines a few years ago. It's a very extensive set of guidelines for our provider network. And likewise, CBH has its own set of policies and procedures. And in both cases, it's very clear that the requirement around cultural and linguistic competence is that our providers will be able to meet the needs of the community in the most culturally competent manner possible, including people with limited English proficiency and also hearing impaired as well. We have a significant deaf and hearing impaired population, and we, have also developed guidelines around how to assure that they're able to access services. CBH members also have a handbook, and it's written in several languages, including the list that you see here. Again, that really speaks to the diversity of the communities that we have here in the city and the need for everyone in the city to be able to access this information. In terms of our system of care, we have a county leadership team, and we have and continue to try to assure diversity in terms of our membership. In terms of family members and youth, currently we have 3 African American and 1 Latino family member. All of them are female. Still looking for some dads who can join our county leadership team. And in terms of our youth, we have 3 African American youth. 3 are female and 1 male. And again, that is largely representative of the population that we serve in system of care. But again, as I said, we are continuing to look for diversity in terms of ethnicity as well as gender. One of the areas that we looked at in terms of our journey around cultural and linguistic competence is in the area of disparities. And one of the pretty glaring disparities is that there is an overrepresentation of African American youth in out-of-home placements. And this includes residential treatment facilities as well as our juvenile detention facilities around the state. Another area is around girls and juvenile justice and the needs that those girls have compared with the range of services that are in place to serve them. And I will talk a bit more about both of these a little later, but these are 2 of the areas that we noted in terms of looking at our service array and looking at the youth and families that we serve. In looking at cultural competence goals, we have not, as a county, undertaken the complete CLAS assessment. So we want to undertake that as one of our more immediate goals and then build upon those needs as well as some others that we have identified. So, for example, although CBH may have a lot of materials that have been translated, that is not necessarily true of the provider community, nor of some of our other internal documents that families and youth would want to rely on or get information from. So we need to do more in terms of having translated materials available. And also, we would like to be able to address the needs of youth who end up in out-of-home placements far from the city. And this includes residential treatment facilities and juvenile detention facilities. So in addition to the disparity, we also know that when young people go to facilities outside of Philadelphia, what we hear, and this includes from youth who have been in these facilities, is that there really is a lack of understanding around urban culture, around the culture of youth from Philadelphia. And there's also a lack of some of the, what we would call, I guess, basic necessities that different cultural or religious groups might need, but when they are far from home and far from their communities, they're not able to access. So an example that I can think of is, there's a parent who shared with us that her son is in a detention facility right now, quite far from Philadelphia, and he is, practicing Muslim, and is not allowed to wear his kofi, which is the headpiece that is worn. So that has been an issue because, in his view, it's interfering with his ability to practice his religious beliefs. But it's a very common sort of rule, that, everyone has to basically line up and be the same, quote unquote, without understanding that there are some unique needs that young people have when they go into placement. So that's just one example. In terms of what our department has implemented around trying to assure that we can meet the cultural needs of the community, we now have, and have had for several years, a person-first unit, which ties into the definition that I referenced earlier. And that unit really works very closely with communities in the city and is focused on assuring that our provider network and our other community supports are able to provide services that are culturally and linguistically competent. And another very key part of this unit is the LGBTQIA task force. We have really undertaken some very in-depth work with the LGBTQIA community here. We have a staff person that's assigned to this piece and heads up the LGBTQIA task force that we have around this population. We also have a faith and spiritual affairs unit, because spirituality, again, is another component of wellness and another component for many people in terms of their cultural identity. And so in 2005, this initiative was started because there was a realization that, many people have very active church lives and are engaged in their faith communities. However, there still was quite a bit of stigma or lack of understanding in many of those communities around behavioral health, mental health issues. And also, many of the churches serve as a gateway to reaching people who otherwise might not have access or know where to go for behavioral health services or supports. So this initiative basically partners with city churches, mosques, synagogues, and is really dedicated to helping to reach many people, including people in underserved communities that may not otherwise have access to this information. There's an annual conference, spirituality and behavioral health conference every year. And most recently, back in March of this year, there was a forum on integrating spirituality and behavioral health and why it matters. They had about 200 attendees at this particular forum. So this is just one example of, the work that unit is involved with. Another event that's internal, that's a very fun event, is that DBH sponsors a diversity day for staff. And people are invited to have a table and to bring anything that relates to the culture that they are representing. Everything from, certain dress wear to food to music, whatever they would like to share about their particular culture. And the poster that you see, the saying, is one by Maya Angelou. We should all know that diversity makes for a rich tapestry, and we must understand that all the threads of the tapestry are equal in value no matter what their color. But this is an annual event, and it's been quite fun and interesting to find out, people that work with, what their cultural heritage is, and to see how proud they are of that and to share in that. Now, some of the initiatives really are geared towards specific underserved communities around, meeting the needs of particular communities, particularly in the refugee community. West African refugee community is a rather large one in the west area of the city, and Project Tama is one of the I think, very innovative programs that has grown up to serve that particular population. And so they work with adults and with children and their families. And a lot of what they do is around outreach, with the community, with leaders from that community, engaging in their cultural events, fairs, celebrations, as well as having a support group for parents that is a safe place for the parents to come and socialize and bring their food and share with one another. Philadelphia also has a very rich Asian American community, and in 2006 there was an Asian Behavioral Health Task Force that looked at the particular needs of the Asian community, which in and of itself is very diverse. There is a very large Southeast Asian community, and I highlighted one of the initiatives, which is called Southeast by Southeast. There's, again, a refugee community, mostly of Bhutanese and Burmese, and in that community, there is a partnership of Mural Arts, and Mural Arts is, for those of you who may not be familiar, is a citywide initiative to create murals around the city in places that, initially it was targeting places where, the buildings had fallen into disrepair or the communities were in need of beautification, and it has since expanded to become a really ambassador of culture and creating art around the city to represent the rich diversity of our city. So in that regard, Mural Arts partnered with this refugee community, and they planned a mural to celebrate that particular community's culture. And there is a center that was set up where people could come together and share their food, share, cultural celebrations, art. Art is a huge piece of it, but they also could take English as a second language classes, etc. So just a place where this community could come together safely and support one another. So here is a photo of the center that was set up for Southeast by Southeast. And you can see some of the beautiful work that was done here to beautify that space. And these are some of the participants in that program. So there's a lot around art. There's separate groups for the children as well as for the families. And mental health services are delivered also through the center, but again, it serves as a much larger community base for this population. The next slide talks about one of the disparities that was mentioned earlier, so girls in juvenile justice. I won't read through the slide, but again, this is a need that we identified, and there's a girls' juvenile justice work group that has been set up to take a look at how can services be more gender responsive to girls, how can programming be better designed to meet their needs, because currently community-based providers really are reluctant to work with girls in the juvenile justice system. Another somewhat newer initiative from, I guess it's been in effect about a year now, is the Department's Engaging Men of Color initiative, which is designed to address the impact of health, economic, and educational disparities experienced by males of color. That includes African American, African, Asian, Caribbean, and Latino throughout the community. And it also includes, adolescents and young adults, which is, our population. And again, it's around engaging this population by trying to build capacity to serve them, as well as to reduce the stigma that often is still part of these communities around mental health. One of the pieces I wanted to highlight from this initiative is that our Juvenile Justice Detention Center has contracted with them to have weekly workshops where representatives from EMOC come out and meet with the young men who are there around trying to build their resilience. And they just announced that they will be launching a Mural Arts initiative, which will focus on the engaging men of color and building brotherhood, which is the tagline for this initiative. So it's very exciting. It's kicking off next week on April the, actually this week on April the 8th. In terms of disparities, as I mentioned earlier, in our system of care work, we have noted that there is an overrepresentation of African American youth in residential treatment facilities. So while 59% of children who are enrolled in CBH are African American, they represent over 72% of children who have been placed in psychiatric residential treatment facilities. So clearly there is a disparity in terms of use of high-end residential placements for this population. So what we are looking at is really trying to create more community-based options that are both culturally relevant and effective, to expand the use of high-fidelity wraparound, which right now is a very small juvenile diversion program, but to expand that and to explore some other models, such as Open Table, which is a faith-based intervention using the church community as a way to reach out and support people coming back into the community, and seems to have some promising efficacy for African American youth and their families in particular. So that ends my portion of the presentation. Thank you, and if there are any questions.
Yes, if anyone has any questions, please enter them into our chat box, please.
Hi, this is Shannon Thomas from Delaware County. I am unfortunately not on the webinar. I'm just on the conference call. But I wanted to know, do you have any outcomes on the hi-fi being used as diversion for juvenile court? Do you have any outcomes on how that's doing for your population?
Yes, we do have some outcomes, which I'd be glad to share with you. But
that would be great.
Yeah, I can get that out to you. I guess I can send it through you, Kelsey, because we do have some outcomes around very low recidivism, rate as well as very low rates of return into deeper levels of care, like back into either RTF or NP.
Yeah.
Yeah.
Well, I'm from Delaware County, so we're right next to you, but we did an internal study too, and we saw some of the same, but I'd just be curious to kind of see yours too.
Absolutely, and feel free to contact me. I didn't put my contact information up on the PowerPoint, but it is Valerie, VALARIE .Olds, OULDS, at PHILA, PHILA.gov, G-O-V.
Thank you.
Great, thank you. Are there any other questions for anyone who's not on the web portion? Okay, well then we'll move on. Thank you so much to Valerie for your presentation. And we are now moving on to Jason Landau Goodman. So we're so thrilled to have him presenting as well today. Jason is the founding executive director of the Pennsylvania Student Equality Coalition. He has been a leader in the lesbian, gay, bisexual, transgender, and queer LGBTQ youth movement for over 5 years. And as the first person to specifically coordinate LGBTQ youth advocacy on the statewide level in Pennsylvania. A fifth-generation Pennsylvanian, Jason is from Lower Merion Township and is a recent graduate of the University of Pennsylvania. Through his activism at Penn, he has been named one of the top 12 LGBTQ youth leaders in the United States by Campus Pride. He works directly with LGBTQ student organizations throughout the Commonwealth in order to advance meaningful public policy in local and state governments towards social justice. So thank you, Jason, so much, and we'll let you take over, and I will progress your slides for you.
Thank you so much, Kelsey. Good afternoon, everyone. I'm very excited to be with you this afternoon today. I've had an opportunity to meet with several of you through system of care events and community programs, and I really appreciate all you do to increase the efficiency of youth services throughout the Commonwealth. We have a lot to do out there, but we start where we can in one county and in one site with one young person at a time to make the overall changes that we seek to have done, and you are doing it, so thank you. But this is the work that we're doing together. Today I was asked to speak specifically on the resiliency of young LGBTQ Pennsylvanians. We certainly have desperate circumstances all around us, and I don't want in any way to diminish them by spending more time being based more on the solution side of this work today, because these are critical narratives and these are the lives that must be out at the forefront of our minds to inform the work we do each day. But as a tool to understand the larger picture, I'm happy to focus on our success stories and more than welcome to elaborate on an example if you like. If we go to the next slide. So again, and I'll go into a little bit more about the work that we do with my agency, but we are
Welcome to Verizon Wireless. The wireless customer you called is not available at this time. Please try your call again later. Announcement 1, switch 3 to -4.
Are we still here?
Yes.
Welcome to Verizon Wireless.
Okay.
The wireless customer you called is not available at this time. Please try your
we'll
call
just let
again
that play
later.
out.
Announcement 1, switch 3 to -4.
Left.
Okay.
We're checking on our end just in case.
Okay.
Joined.
Okay. I think you're good now, Jason.
Great. So we are a coalition of young LGBT Pennsylvanians throughout the Commonwealth working towards social justice issues. And next slide. I guess it was effectively last month. It was just a week and a half ago. I was in Alabama. I was very humbled to have the opportunity to be in Selma with 70 other young people selected by the National Park Service from throughout the country to march the 54 miles from Selma to Montgomery on the 50th anniversary of the march. This was the third attempt at the march that civil rights leaders attempted to do, in which they were successful in demonstrating for voting rights back in the 60s. And it was quite a life-changing experience. There were young folks from all parts of the country doing all sorts of different work, but when we were discussing our SELMAs today, it was a very intersectional vision of justice, of building these beloved communities throughout the country. And from Ferguson, Missouri to Tuscaloosa, Alabama to San Francisco and Lower Merion, Pennsylvania, we were there talking about, as young people, as a millennial generation, how we were going to be able to tackle these social issues. In Pennsylvania, we are doing this work through that lens as well. We recognize that we need to come together to heal our communities and each other in all of what we do on the personal level. Because just as we can get policy work done for LGBT students in one way, that may not stop all of the harm that young LGBT people may face. We don't live our lives in silos, but instead in complex, interconnected identities. We live them all at once. So it's in this approach that we take with PSEC, which is what more young LGBT people are taking a stand on, that we must fight just as hard for racial and economic justice, for increased access to responsible health care, for responsive and comprehensive integrated systems of care, just as we advocate for LGBT-specific issues. And this is part of how we find our resilience. There are approximately just pull up the numbers. There are approximately 135 young LGBT Pennsylvanians, ages 16 to 24 in Pennsylvania, from rural, urban, and suburban communities, and they face quite varying circumstances, ranging from isolation and lack of supportive services to certainly increasing amounts of thriving supports in schools. But LGBTQ youth exists through all backgrounds, races, ethnicities, economic resources, faiths, abilities, etc. In K through 12, we estimate there's about 81,000 LGBT students in the state. We estimate also that there's about 4,500 unaccompanied homeless youth also in Pennsylvania, and approximately 7% of youth in foster care identify as LGBT. So we are out there and we are facing disproportionate impacts on a variety of social systems. But again, we're going to focus more on the resiliency stories today. So coming from a more personal point, if we could advance a few slides. So we'll skip the next slide and go to the one with Brandon. The story of my organization began in 2010-11, and I had just started at the University of Pennsylvania in Philadelphia, and was realizing some work that needed to be done between connecting the LGBT young people at schools throughout Philadelphia and in the region. And we identified that we were dealing with very similar administrations, very similar circumstances in terms of what was going on in our communities, and the need was brought to our attention of working together to address these issues. So we started to form a more social network, loose coalition of student leaders, and as time went on, we started to realize the potential for what we could do. But there was a moment when I was up at a conference in late 2010, it was November 4th and 5th, it was November 5th, 2010. I was at a conference in Bloomsburg, Pennsylvania, and as we were getting ready for the day, someone came down the hall and started to share some news that just a few miles away in Snyder County, a 14-year-old named Brandon Bittner, who was relentlessly bullied in his school, in his high school in Snyder County, had walked 7 miles from his home at 3 a.m. that morning to end his life by walking in front of a tractor trailer. The fact that another young person who had been targeted because of how he expressed himself was put into a position that he felt he had no other option but to end his life. It was heartbreaking. And these are stories that happen time and again, and it is just heart-wrenching to know that other individuals who are in our communities, especially our, from my perspective as our peers, are facing these challenges, and the thousands that experience bullying, harassment each day in school, and live with that trauma. So at that moment, I was inspired personally to say enough. We have to take what we're doing to the next level and stand up for each other. We have to start speaking out about our authentic lived experiences and address these issues with our service providers, with our schools, with our government officials. And so we took a look to history for some strengths for our own resiliency. So next slide. We looked toward the Civil Rights Movement and the Student Nonviolent Coordinating Committee, known as SNCC, which some of you may be familiar with. It was the leading student arm of the Civil Rights Movement. John Lewis, and who's now a U.S. representative, Julian Bond. There were many other prominent leaders who helped form and grow SNCC to do what it was able to do, from the freedom rides to helping be an integral force in the movement in Selma. But this was very serious work where young people were able to advocate for issues in their communities. So we took a look at how they were structured in a more group-centered leadership, servant-based leadership community, and formed our own organization in Pennsylvania. So next slide. Sorry, I'm just advancing. There we go. We work with in local communities, particularly to raise up the voices of young LGBT people, as well as with local governments, and work on state legislation, primarily the Pennsylvania State Schools Act, which is the anti-bullying bill, which I encourage you to look more up after the session today. Next slide. And we are engaging with our public officials on these issues. The next slide. Actually, next slide. Perfect. So part of this work at the local level is the work to form and create gay straight alliances, or now as they're more increasingly being known as gender and sexuality alliances. These are student organizations that provide meaningful safe spaces. They provide event programming. They provide the ability for students to be able to talk openly about issues of sexuality and gender in schools. Often these can be created in hostile places. This student-led activism is forging the way. In Pennsylvania, it's almost once a year, however, that we see a GSA that experiences some issues in its ability to form, whether it's a school administration or a school board that attempts to block their formation. We've had a string of these in central Pennsylvania, from Cumberland Valley and Chambersburg, Big Spring, East Pennsboro, just in the past few years. In Lehigh Valley, we've seen issues in Emmaus and Bangor. In western Pennsylvania, it was just last year in Grove City. However, in each of those places, young LGBT people have been speaking out and winning on these issues, because the law is on the side of the ability to form these organizations through the Equal Access Act of 1984. So these are just one of the ways in which young LGBT people are taking a stand in Pennsylvania. One of them was created in late 2013 in Richland High School in Johnstown. And so the picture that you have in front of you is of Casey Karen, who was a high school senior at Richland, and he was running for homecoming court. He is a transgender student. He was a transgender student at the time in Richland. He had most of his documentation updated, including his driver's license. He had been affirmed and had transitioned to be male, and he was assured by his administration that he was going to be able to be on the male side of the ballot for homecoming court. However, at a last-minute decision, they put him on the female side of the ballot. It was very problematic and horrifying experience. He, along with other students in the district, were able to address these concerns with the school board, who did not take any meaningful action, unfortunately. And it also brought up questions about what name would be read at graduation, what color gown he was going to be able to wear. And on some of those issues, he was able to win, particularly on the gown issue. But he was also able to create the GSA there in Richland, which is the first in that entire region. So that is very exciting. Next slide. And he also had a very supportive family and has been continuing that work starting as a student last fall at IUP. So this work is continuing one school at a time, and certainly increasingly in our rural areas. Another story which has a similar chord is the story of Isaac Wolf, who was also whose story also grabbed national, international headlines from Pennsylvania. You go to the next slide. Awesome. So this is Isaac Wolf. He was also a high school senior at Red Lion Area Senior High School in York County. And he was running for prom king. And again, issues with the administration and the inability to have conversations with the district about transgender students and the importance of having the support there in the schools and in the communities, Unfortunately, he was not able to compete for prom king, but through working with the administration and we were there on the ground and supporting him. He was able to attend prom with his date and able to go to his graduation and wear the gown of the other males were wearing. But his birth name was still red, which was unfortunately traumatizing and very upsetting. But if you go to the next slide, the following slide after that, at his graduation, we were there. We had a card signed by over 1,000 people from across the country there in support of him, which was meaningful. If you go to the next slide, we had another incident involving a trans student up at a college in North Central PA in Huntington County. And it was an unfortunate situation where there was a transgender student who was living in her affirmed gender as a woman and was very accepted at the community. But there was one individual in her dorm which raised her flag, and that unfortunate discomfort traveled its way up to the administration, and it presented an ultimatum to the student that they were unable to use the bathroom in their dorm, but instead one almost a mile away at the other side of campus, which was designated as a gender-neutral bathroom. It was a very unfortunate situation. That student unfortunately had to move off campus to just remove themselves from the situation. However, a generation of student leaders later, this spring, students at that school now have over 50 gender-neutral bathroom signs up on the campus. And those bathrooms are now all gender bathrooms. So sometimes it takes these unfortunate situations to be brought to light for student and young leaders to press for the changes that need to be made with any administrations or service providers to make sure that these spaces are accessible. Let's go to the next slide. So at the University of Pennsylvania, where I'm a recent graduate of, as a student leader there, we helped press for trans-inclusive healthcare insurance, and that is a critically important component to healthcare insurance, so that transgender individuals have access to the healthcare services that they need, medically necessary evaluations, as well as access to triadic treatment, which includes hormones, therapy, and any gender confirmation processes. So we were able to have stories from students presented to the administration in public ways, and we were able to work with them as partners to get inclusive healthcare insurance for faculty, staff, and students. And increasingly, we're seeing schools, businesses, nonprofits update their insurance policies to be inclusive for transgender folks. If you go to the next slide, also part of this work in forming GSAs is also forming safe spaces for young people who come from the diversity of backgrounds. We're seeing increasing numbers of LGBT student of color groups, from Allegheny College's The Family for students of color, to Swarthmore College and the University of Pennsylvania having LGBT student groups for Asian students. So we're seeing more safe spaces being promoted that allow for LGBT youth with specific backgrounds to be able to share their unique experiences, and those are very important. So if we go, I believe, the next slide. Yes. So in a more broad context, With all of these things that are going on, the LGBT rights movement is very much at a major climax, with certainly marriage equality seen as a paramount center stage issue and its resolution hopefully coming soon through the Supreme Court. But it's very important, especially as young LGBT people, our experiences are vastly more concerned with discrimination and violence in our communities and schools, hostility and the inaccessibility of systems that provide us with care, poverty and homelessness, sexual assault and violence. Our focus must and will remain on these challenges to lifelong success. There is little doubt that full equality under the law for LGBT people will be achieved in the next few years on the federal level. However, it will be up to our generation to ensure these laws are fully executed. In paraphrasing the keynote speaker of our annual Pennsylvania Youth Action Conference, Allison Robinson from last year, which was the theme of the conference was Igniting a Pennsylvania Youth Movement for Trans Justice and Freedom. She said that sexism did not end with the 19th Amendment, nor did racism end with the Civil Rights Act of 1964 or the Voting Rights Act of 1965. These are battles that we are still fighting and waging, from every school board meeting, with every legislative hearing, with every team meeting with a service provider or community partner, with every parent and youth we interact with. Our battles and our SELMAs are now, and they are right in front of us. So I hope that you would join me in continuing to recognize the full autonomy and dignity of young people, and certainly young LGBTQ people, who are often so robbed of their worth by their families and society. Living in trauma, living in shame are no ways to empower young LGBT people into resiliency. We must build and grow our partnerships with young LGBT people in all parts of our work. As the adage goes, if you are not at the table, you're on the menu. And with any constituency, they must be at the table helping lead the work, because then it will be the best informed work and sustainable with those you target and having ownership of it. Let's continue to ensure LGBT youth are informing the practices that directly impact their lives. Let's make sure we are working together in partnership to authentic resiliency of all young people. So with that, we can hand it over to any questions you may have. Thank you.
Great. Thank you so much, Jason. As before, if anyone has questions they want to type into the chat box, feel free. Also, if you're not on the GoToMeeting function, please feel free to ask your questions on the line now.
Can you unmute them, please?
Left.
D. Walker?
Left.
Okay, we have some people leaving the line, but Jason, I'd be curious to ask what you feel would be one of the most tangible ways for our system of care counties to get involved with the work that you're doing through your organization, and how they might be able to partner with you and some of your initiatives.
Great, yeah, absolutely. So directly, any young people you feel that would be interested in this work, please send them information about our organization. We have plenty of opportunities for new leaders to engage with this community, certainly from any regional meetings or our annual state conference, as well as other activities throughout the year. We provide trainings, so that's directly for any specific provider or agency or IU around the state. If you would like us to help, come to your area and provide a training, we have a whole part of our website, pennsec.org. That's PENNSEC.org. And we have a whole section there about the resources that we provide. Certainly, if there's any incident or situation you'd like for us to be of service on or help provide advice in any way, we're more than happy to be in touch about that. And just generally be aware that we are here and we're able to help you with any needs that you may have, particularly to LGBT youth communities. And if we are unable to help you, we will certainly know other organizations in the LGBT community who may be able to help you as well. But there's so much to be done, and there are so many young people who need these outreach, this kind of outreach in their communities and this exposure to these issues and other LGBT people and young LGBT people as other, role models, if you will, from their peers to be able to know that there are positive experiences out there and we can learn and build a community with each other. That's one of the major challenges with Pennsylvania particularly, is that we are a largely rural state, and it can be hard for other LGBT people to meet and engage with each other. So that's the platform that PSEC helps provide, and more than happy to help connect you or young people in your agency with others.
Great. Well, thank you so much. We really enjoyed your presentation. We had one other question. If you could just repeat the name of your website again for those on the call. They wanted to be able to write that down.
Sure. That's PENNSEC.org. That's PENN, S for student, E for equality, C for coalition.org.
Great. Well, thank you so much. So that actually brings us to the conclusion of our webinar for today. We want to again remind you of our upcoming webinars in our CLC series for 2015. Again, on April 14th, we'll be looking at working with linguistically diverse populations in the Pennsylvania system of care. And then on April 21st, we're going to have a presentation on our CLC pilot project we've been working on in the Pennsylvania System of Care Partnership. So again, we want to thank our presenters today, Valerie and Jason. They were fantastic. You can contact me at leonardkt@upmc.edu if you have any questions or would like additional resources regarding today's webinar. The PowerPoint and a recording of today's session will be available on the Pennsylvania System of Care website. And we just want to thank you for participating. I will let Pat Cambry, who I believe is on the line, conclude with any last-minute announcements.
Especially our speakers for taking the time out of their really, I know, busy schedules as well to provide us with information and knowledge that we can use going forth. And the information will be uploaded onto our website, Pennsylvania System of Care Partnership, where you'll be able to get the PowerPoints and have, the other contact information that had been in question. So thanks all, everybody, and go out and enjoy this great day.